Thank you and good afternoon. My name's David Jernigan. I'm an associate professor at the Johns Hopkins Bloomberg School of Public Health and the director of the Center on Alcohol Marketing and Youth. Let me reinforce some of the data about youth and drinking. Alcohol is the most commonly used drug among young people. In 2010, there were approximately 10 million underage drinkers between the ages of 12 and 20 in the US, 6.5 million of whom report binge drinking. Alcohol is also a key factor in the leading causes of death among 12 to 20-year-olds: unintentional injuries, homicide, and suicide. Every day, 4,500 young people in the US start drinking, and every year, we lose 4,700 young people because of alcohol use. The prevalence of binge drinking among male high school students has declined since 1991, but has remained largely unchanged among females. As a result, about 1 in 4 high school students report binge drinking in the past 30 days, and this is likely to be a substantial underestimate of actual alcohol consumption in this population. A growing body of studies has followed groups of young people over time. These studies have generally found that the more young people are exposed to alcohol advertising, the more likely they are to start drinking, or if already drinking, to drink more. Various forms of alcohol advertising and marketing that predict drinking onset among youth are listed here. And I will discuss youth exposure to magazine, television, and radio advertising shortly. The key problem is that the alcohol industry's own self-regulatory codes are the principal way that young people are protected from alcohol advertising. These codes cover both content, what's in the ads, and placement, what age audiences will see, hear, or read them. Regulating content is very difficult. Content is subjective, it raises First Amendment issues, and it disappears quickly, particularly in digital media. One example of a self-regulatory provision is from the Distilled Spirits Code. These ads are not supposed to have indecent images, but they frequently use sex appeal to market alcohol. Unlike content, ad placement, what audiences see, hear, or read the advertising, can be measured, at least in traditional media. By 2003, the wine, beer, and distilled spirits industries had all agreed to advertise only where people under 21 comprise less than 30% of the audience. The National Research Council and Institute of Medicine in 2003 and 24 state attorneys general in 2011 called for a stricter standard because 12 to 20-year-olds are the group most at risk of underage drinking. They are less than 15% of the population. So the industry's 30% standard allows them to be exposed at more than double the rate of the rest of the population. A 15% standard based on persons aged 12 to 20 in the audience would more effectively prevent overexposure of this vulnerable group. Self-regulation requires an independent monitor. And since 2002, the Center on Alcohol Marketing and Youth, or CAMY, funded by CDC since 2009, has been that monitor. It uses media industry standard data sources to monitor compliance with industry placement standards and to compare youth to adult exposure. We found, for example, that in 2008, youth ages 12 to 20 compared to adults 21 and over saw 10% more beer ads, 16% more ads for alcohol pops like Smirnoff Ice and Bacardi Silver, and 73% fewer ads for wine in magazines. 79% of youth exposure occurred in magazines with disproportionate youth audiences. In 2009, there were 315,581 alcohol product commercials on US television, and youth were more likely per capita than adults to have seen more than 67,000 of these ads. The average TV watching youth saw 366 alcohol ads on television alone, an average about an ad a day. Nearly 24,000 of these ads were placed in violation of the industry's voluntary 30% threshold. And youth exposure to alcohol ads on television is growing more rapidly than adult or young adult exposure. On radio, we were able to get data for 75 local markets for 2009, covering about 42.5% of the US population ages 12 and above. 9% of the placements violated the 30% standard, and nearly a third played on programming youth were more likely to hear than adults. and generated more than half of youth exposure. This slide shows a tool on the CAMY website where users can put in their media market and see the local results. Monitoring must occur at the brand level because different alcohol brands pursue different advertising strategies. A small number of beer and distilled spirits brands, less than 10%, is responsible for at least half of all youth exposure by medium. Monitoring across media is also critical. For instance, while youth exposure has been falling in magazines, it's been rising on television. As you can see, the adoption of the 30% standard in 2003 had little impact. There are limitations to our monitoring activities. The survey data we use is based on consumer self-reports of exposure, which may be inaccurate, but which help form the basis for alcohol company decisions about where and when they advertise. We cannot link brand-specific ad exposure with youth alcohol consumption because data are not available on youth alcohol consumption by brand. And alcohol companies are moving away from traditional towards digital media, which cannot be assessed using the traditional methods we've used. For example, while companies like Nielsen can provide demographic information for Facebook as a whole, such information is not available for Facebook pages hosted by individual alcohol brands. Much of digital alcohol marketing is created by users and is spread virally, making it difficult to control. Young people and the alcohol companies are both early adopters of these new technologies. Our center has found that alcohol brands have amassed millions of likes or fans on Facebook, and their pages have tens of thousands of photos and videos posted by both the brands and users. Facebook illustrates many of the problems posed by alcohol marketing in digital media. Age gating, assessing the age of users of the site, is imperfect. Facebook requires alcohol companies to register as such and to block access to their pages by users with a Facebook age below 21. But an estimated third of minors on Facebook are there with false ages, and persons between the ages of 18 and 20 can change their Facebook age in just a few clicks. Age gating also only applies to the alcohol brand pages, not user-generated pages using branded and trademarked alcohol marketing content. We know young people are on the alcohol brand's Facebook pages because we can see the photos of themselves that they have posted there. What can be done to reduce youth exposure to alcohol marketing? We need to maintain the monitoring of industry activities in traditional media. Exposure standards need to be complied with and strengthened. The 30% standard permits disproportionate exposure of underage youth. The Federal Trade Commission has asked for a 25% standard, and one company, Beam Incorporated, has adopted it. The National Research Council, Institute of Medicine, and 24 state attorneys general have called for the 15% standard, and our modeling of 15% found it would reduce youth exposure, save the industry money, and have virtually no effect on the industry's ability to reach young adults, its often stated target for this advertising. The Federal Trade Commission could collect and report annually on alcohol industry spending on marketing, just as it does for tobacco marketing. Companies and media outlets should tighten their age gating, especially in digital media. And companies should, as the FTC recommended in 1999, establish no-buy lists, committing not to advertise on programs and in venues where youth overexposure is likely. Public health has an important role to play and can inform efforts to reduce youth exposure to alcohol marketing by, for instance, restricting outdoor alcohol advertising near schools, churches, and on public transit, where young people are likely to be present, restricting alcohol ads on retail outlet windows, and banning alcohol advertising on state-owned property, including institutions of higher education.